Hi everybody, this is Stephen Kaplan, and my action plan is about cervicalgia or neck pain and acupuncture with an attempt to avoid opioids as they are addictive. My action plan goal is to introduce acupuncture for the treatment of cervicalgia neck pain and research with evidence to help educate my community on the benefits of acupuncture and also to assist people in relieving their pain and hopefully avoiding the use of opioids. I like to follow a who, what, why, and how process. So in an effort to create relevant and meaningful approaches when talking with people in the community, I try to create value by using this approach. And I learned from a transformational workshop that I did that it's not necessarily what people do, but why they do it and how they do it that helps others to build understanding and trust, which is something that I think is very important in delivering a workshop like this. So the question of who is, who will this benefit? This will benefit people with acute or chronic neck pain, preferably in the range of teenagers to seniors. And that could be anybody, for example, who had an accident or age-related degeneration, posture-related pain, or even other chronic pain-related sources of their problem. Then I want to talk about what is neck pain, to introduce that to the audience. I will try to explain to them some of the anatomical issues and muscle tension issues or nerve-related or trigger points. When I deliver the workshop, I will probably have a PowerPoint presentation, and I'll use anatomical diagrams to show them what the inside of their body looks like and also what causes their neck pain so that they can develop an understanding of what it is that I'm talking about. The other what would be acupuncture. What is acupuncture all about? And the why. Why am I doing this? I want to help people to relieve their pain, and I want to help them avoid using opioids or addictive pain medication if at all possible. And acupuncture is very well known for pain management. I've been working with chiropractors for many years, and I feel that the spine is something that I'm very comfortable working with. When people experience neck pain, for example, it can be very debilitating, and it can increase a substantial amount of stress for them. It can generate fear and concern, and that can affect them in their personal life, their family life, and in their work life as they need to move around and conduct their activities in order to take care of themselves and their family. The other component would be how, and I want to explain to my audience how would acupuncture help them. So I would try to help them understand how acupuncture works, and I will bring research articles to the workshop and cover some topics that I think would be relevant for the audience in helping them to develop an understanding. The other aspect of how would be, how do I do it? How is my office set up? So I would explain to them about my office waiting room and how we have a private treatment room that they can lay down and listen to music and be very relaxed and comfortable when they're receiving their treatment. So in explaining how it works and how I do it, I'm trying to build trust for the people in my audience, and hopefully they will want to come in for therapy. When I deliver my workshop, I will aim for a 30-minute PowerPoint presentation with time for questions and answers, And some of the common questions that I will be looking to hear, which I've heard many times, are things like, does acupuncture hurt? And where do the needles go? And how does it work? I've already explained a little bit about that, but it wouldn't stop somebody from asking the question anyway. And I want to be prepared to answer their questions in an effort to give them voice and build more understanding, in an effort to build trust and connection. I will try to perform several test runs of my presentation so that I can be prepared with timing and review it for value, always trying to make sure that the material is relevant for the audience that I'm talking with. When I come to the presentation, I will bring materials with me, such as business cards and brochures, things that are examples of my commitment and professionalism. Nowadays, everything is electronic, but I think that having a piece of paper in hand does add something for people. Not everybody wants to go into their computer or look at websites, but a simple business card with some artwork, an address, a phone number, it very quickly shows where I'm located. They can leave it in their car or in their wallet. And a brochure. A brochure would cover the why and the how and the other aspects of what I'm trying to bring across for them in this specialty treatment. And it would also include a bio of myself so people can see more of what I'm all about. So in essence, my 3 W's and my how would be in the brochure as well as a bio. And I've already decided to use Vistaprint as my source for my printing materials. I've been using them before, and I already have information in there that I could continue using. My goal is to bring this to adult education venues in my community, preferably within 10 or 20 miles of my clinic. And I would reach into school districts in the area and the community college and also houses of worship that may be interested in hearing a lecture or a discussion, and also fraternal organizations such as the Rotary Club, the Lions Club, and the Masons. And I would submit an application with them for a 1-hour talk and possibly have some desserts or snacks, maybe coffee or tea, things of that nature, to help people to just settle in and feel more comfortable. I always feel that food and snacks brings people. I like that. I will feel that it was successful after conducting a short survey of about 4 questions after the workshop, and also including a question of what other topics might be appreciated in the future. So if I get good feedback through that survey, that will make me feel that the process is successful. I would also consult with the education director that I'm working at that venue and inquire if they would like to run it again. If they do, that would also give me a feeling that things were liked and hopefully successful. And finally, if a patient gets referred or comes in to the office from one of these venue workshops, that will definitely show me that something is being successful. And finally, in my PowerPoint presentation, I will give them handouts of the presentation, and it will also have resource links to articles that I used and other resource links that they can use to look at more information. I think that adds credibility to the presentation, and it gives them some more information that they could, if they like, go home and research. Thank you very much.